So this presentation is going to be about how to evaluate inconsistency in network meta-analysis and an approach that we've developed for testing for inconsistency within loops in a network. Before I get started, I'd first like to acknowledge all my co-authors on this work, who are from UCL in London and the University of Bristol. And also, before we get started properly, we'd like to find out a little bit more about who's in the audience and what your experience is with network meta-analysis. So we're going to run a quick poll asking you about your experience of network meta-analysis, which I think has just launched. So yes, I know you can't see, I can see that the answers are coming in, and there are still more answers coming in, so I think we'll give it another 10 seconds.
Okay, I think we can end it now and I'll share the results.
Okay, great, thank you. Okay, so that's really useful to know, thank you. So, so nearly everybody has either already had some experience of conducting network meta-analysis or plans to. Okay, that's really useful to know. Thank you for taking part in that. Okay, so I'm going to now move on. And so I think for a lot of you, this will be very familiar. But for people who haven't been so involved with network meta-analysis, I will start with some introductions to why we do a network meta-analysis. Okay, so I'll start by introducing an example to help explain the motivation for network meta-analysis. And this example comes from a project I was involved with in the area of prostate cancer, where we were comparing the effectiveness of 9 different treatments. So the traditional approach to comparing each pair of treatments would have been to carry out a series of pairwise meta-analyses to compare each pair separately. We would then have reported the set of multiple meta-analyses together in a systematic review and summarised the results. But in recent years, network meta-analysis has become increasingly popular. In a network meta-analysis, we collect data from eligible trials comparing any of the treatments of interest. So in this plot, each line connecting 2 treatments represents a comparison for which 1 or more trials has been carried out, and the number indicates the number of trials we have available. Having collected all the data, we then perform a single combined analysis in which we compare all treatments simultaneously using all of the data available. By performing a combined analysis of all available data, we can answer additional research questions which couldn't be answered using the results from a series of pairwise meta-analyses. So, for example, we might want to ask which treatment is believed to be the most effective treatment overall amongst all the treatments considered. We probably want to rank the treatments with respect to their effectiveness and possibly with respect to their safety as well. And then the rankings, possibly both sets of rankings, can be used to inform clinical practice. Also, in a network meta-analysis, we can make use of indirect evidence as well as direct evidence. And this means that we gain precision in estimation. I'm going to explain more about indirect evidence on the next slide. Using indirect evidence means we could use this data set, for example, to estimate the treatment difference between brachytherapy and cryotherapy, for which no direct trial data are available. So in various different ways, a network meta-analysis is more informative than a series of pairwise meta-analyses comparing each pair of treatments in the network. I'll now explain a bit more about using direct and indirect evidence. So in this network, the A versus B comparison is informed only by direct evidence because 2 trials have evaluated this comparison. The B versus C comparison is informed only by indirect evidence from the network. No trials evaluated this comparison, but we have indirect evidence from using the A versus B and A versus C trial data. The A versus C comparison is informed by both direct and indirect evidence, because one trial evaluated this comparison directly, and we also have indirect information from using the A versus D and D versus C trials. The use of indirect evidence in addition to direct evidence means that we have to be concerned about consistency between different sources of evidence. Standard models for network meta-analysis rely on an assumption of consistency, which means we're assuming that the direct and indirect evidence agree for each treatment comparison. Wherever there's a loop in a network meta-analysis, such as ACD in this example, there's a potential for inconsistency, and it's important that meta-analysts test whether the assumption of consistency holds in their network. There are several reasons why consistency might not hold in a particular network meta-analysis. It could be that patients in the A versus C trials are systematically different from the patients in the A versus D and C versus D trials. For example, they could be different because they were ineligible to receive treatment D. Alternatively, it could be that treatment A was implemented differently when it was delivered in the A versus C trials than when it was delivered in the A versus D trials. For example, because the dosing is different or the treatment schedule was different. Or potentially, it might be that there were systematic differences in the time periods or the settings of trials evaluating different treatment comparisons. For example, if the A versus C trials are very recent because A is a new treatment, while the C versus D trials are older. Any of these reasons could mean that the assumption of consistency doesn't hold in the network. There are several existing methods for carrying out local tests for inconsistency within a single loop, such as the node splitting approach. If there are multiple loops, we could test the loops one by one, or we could test for inconsistency across all loops simultaneously. If we want to carry out a global test for inconsistency across the whole network, the standard existing approach is called the design by treatments interactions model. But the test carried out under this approach often lacks power because the degrees of freedom for the test can be much larger than the number of loops available in the network. So in the research project I'm presenting today, we wanted to come up with a new approach for evaluating global inconsistency across the whole network. Several existing methods for testing for inconsistency don't handle treatments symmetrically within a loop, and potentially this could cause problems, especially when the model is extended to a global model. So the initial objective of this research was to define a local consistency model that handles the treatment symmetrically within a loop. The next objective was to extend this model to a global model, which allows us to test for inconsistency across the whole network. A global model needs to be fitted to multiple independent loops. And over the next few slides, I'm going to talk about how we identify independent loops. In a large network, like the example on this slide, it's not straightforward to identify a set of independent loops. So our final aim of this project was to develop an algorithm for identifying a set of independent loops in a network in order that they could be included in our global inconsistency model.